My name is Sydney Chartier, and today I will be guiding you through my evaluation project, which looks at evaluating the effectiveness of the bereavement program at the agency I am currently placed in. I am currently receiving my field hours at Northwoods Home Care and Hospice. I've been there, this is my second year there, and I also work, my place of employment is through a hospice agency as well. So I have been in the field of hospice care for a little over 2 years now, and have worked alongside many grieving individuals for some time. So my main thing is I wanted to look at the bereavement program that's offered in most hospice agencies. It's offered. So my plan was to assess the efficacy of the bereavement program that is offered to grieving family members who have lost a loved one, specifically at Northwoods Hospice Agency. So I figured I'd give you guys a little background as to what hospice is for the ones who may be unfamiliar, along with a quick overview of the terms such as bereavement and grief. So what is hospice exactly? Hospice care is a type of healthcare that focuses on keeping terminally ill patients as comfortable as possible by managing their pain and symptoms, as well as attending to their emotional and spiritual needs at the end of their life. Next, we have bereavement, which bereavement is the period of mourning or intense grief after following someone's death. A bereaved person refers to one who has experienced the death of a loved one and is grieving the loss. So sometimes you'll hear throughout my presentation and, along, just in life, you'll hear, a bereaved person, a bereaving person. So, and then lastly, what is grief? Grief is reaction to loss or traumatic event. So although, hospice agencies were mainly focused on the patient, making them comfortable and that sort of end of life care, wishes, needs, things along those lines, hospice agencies are also focused on caring for the family or loved ones as well, friends, close family, and whoever else. So once the patient passes, most hospice agencies offer the bereavement program to the family members or other, again, friends to help support them through their mourning period. So, again, after following the death of the hospice patient, specifically Northwoods, contacts the close family member, friend, or primary caregiver, and enrolls them into the bereavement program with their approval, of course, with their approval. So once they're enrolled in the program, the client will be sent mailings and other resources and interventions over the course of 13 months. So after the 13 months, beginning of when that person passes. So once the 13 months is over, then they are pretty much let go from the bereavement program. And of course, unless they request to stop receiving services before then, which they are more than welcome to. They don't have to have the services that they don't want to. They can always decline them halfway through, a month in, what have you. But they also are allowed to continue the services if they feel they would need them for a little bit longer. So we will continue to send them do interventions or send them mailings if they feel they need a little bit longer. So I'll just quickly kind of go over the slide. In total, they have 60 bereaved clients in the program, which fluctuates. So they send out 6 informational mailings over the span of the 13 months, a monthly letter for 12 months, a minimum of 5 optional contacts, either phone or visit, again done over the 13 months. And that is if the patient wants that. That is not required. Like I said, there can be more than the 5 if needed. Phone calls are made by nurse or social worker to check in and follow up. Additional optional visits and grief support group held annually that Northwoods offers. So my desired outcomes were decrease in grief, increase in overall well-being and feeling of support, increase in the client's knowledge on the grieving process, and then my evaluation questions were, after 1 year, did the bereavement program 1, decrease the level of grief in the bereaved clients. 2, increase the bereaved client's overall feeling of well-being and support. And 3, increase the client's knowledge on the grieving process. So now moving on to planned intervention and rationale. I chose to evaluate the bereavement program as I wanted to further explore if the interventions that were given during the bereavement program were truly making an impact with the clients. Again, decreasing their grief, increasing the support they felt. There is a limited amount of research on the effectiveness of bereavement programs, yet they are largely endorsed at hospice agencies throughout the country, so I think that this is something that's pretty important to look at. And I ultimately decided to monitor the interventions that were given and do a check-in phone call with my chosen participants. So next, we will take a closer look at the logic model that I created. And here I had just attached my logic model where you can see the inputs, such as social worker, bereavement coordinator, and the outputs and outcomes we are looking for. So for my measurement plan, the outcomes that I did measure were again, decrease in grief, an increase in overall well-being and sense of support from Northwood's bereavement program, and an increase in knowledge regarding the grieving process. The measures that I used to monitor my outcomes was a self-report retrospective post and pre-survey, which was given to the clients who were entering their 12th month in the program, as well as an additional check-in phone call, and then the Northwoods interventions continued as normal. Although questionnaires are known to lack validity, I found that utilizing a self-report survey and a retrospective design reduces the response shift bias, and I also made sure that the participants knew that the surveys were anonymous to help aid in honest responses. So for my data collection, it was a post and pre self-report survey that were sent to 8 participants who were entering their 12th month in the program in April. So the self-report survey was sent in the mail to the individual's house. Once completed, the individual mailed it back with the return envelope that was provided by Northwoods. I was the only one collecting the data as it was a smaller sample size. The data collection issues that I ran into was there was no response to phone contacts a lot of the times. I did, eventually called back and was able to talk to almost everyone, but there were a few that just, I don't know if it was different phone number or just didn't want to talk. So, and then the summer surveys were not returned back to Northwoods in the time period that I needed them. So that was one of the issues that I found. Also, individuals did not read the material or partake in any interventions from the program, which caused them to be ineligible to complete the survey just because they didn't actually read any of the mailings or partake in the phone calls. So I just felt that that wasn't going to be a valid response for the surveys. So my chosen evaluation design that I used for the project was the retrospective pre-test or post-then pre-design. It was a program level design, and this type of evaluation only requires one questionnaire and allows participants to reflect back and report how they felt they changed over time. So unlike a classic research design where the researchers collect data at the beginning and then at the end of the study, the retrospective design measures the participants' change at the end of the program by utilizing that self-assessment technique. So my rationale behind this was that I would be asking questions to individuals who were recently bereaved if I were to do just the normal pre then post. These individuals will be experiencing tremendous amounts of grief, and I didn't want to be sending them questionnaires asking them to measure their pain and grief promptly after their loved one passed away. So again, as I say, that this is a time for support, care, and active listening. This is why this retrospective design is perfect for this particular evaluation, as it allows us to not overwhelm our grieving clients, but asking these questions right away. Instead, we were able to ask them at the end of the program, hopefully at a time when they were more stable and accepting of their grief. So I did end up finding a few threats to internal validity, especially when using the retrospective design and the self-assessment measures. So the self-report measures were used, which can be subject to biases and some limitations such as honesty inability to assess themselves accurately, misinterpretation of some of the questions, and response bias. The retrospective design also may cause participants to answer questions in a way they feel the evaluator wants. An individual's self-assessment can fluctuate greatly and may not provide a reliable measure of knowledge, emotions, attitudes, or behaviors. It can really vary from day to day how they're feeling or how their grief is. One day they're feeling good and they have lots of supports around them, which environment is such a major influence on the grieving individual. The next day they could be alone and really dwelling, or there could be something that they could remember their loved one by, a simple photo or some memento that could really change how they feel that their grief is for that day. Finally, the retrospective design can be confusing to answer sometimes, and there's also a recall period, which means an individual may incorrectly recall how they felt prior to starting the program. They may have felt that that their grief was either much worse or it wasn't as bad, but maybe they would have measured it differently if we would have given them the survey right away. So here I have the data analysis. There's the 7 questions on the left here, post and pre-survey questions. And you can see what the post-mean and the pre-mean, where the increases were or the decreases were. If you're looking again and just kind of going over it, there was an increase in knowledge on the grieving process, a decrease in grief, and an increase in well-being and support for the bereavement program. So with questions 1, 2, 3, and 4, we can see that they were statistically significant and had a very large effect size, which can help us conclude that the bereavement program may have had an influence on decreasing one's grief and educating them and supporting them within their first year of mourning. And here I have attached the bar graph as well, where you can see the questions and the main differences between the two, between each question, I mean. So as I mentioned, with the data analysis, I was really pleased to see that there was an increase where we wanted to see increases, which again would be knowledge, just that overall feeling of well-being and feeling confident in the services that Northwoods has to offer, and then seeing that decrease in that grief. I think some of the questions, there was one question that was along the lines of, do you feel alone or lonely without your loved one? And that one I feel is more of a filler in a way, or didn't need to be needed, because a lot of people were like, of course, I still feel alone. That didn't really change too much from before or after. And finally, it was great to see, the major effect size that between the two, between before and after. Next time, when I do conduct another evaluation, I will want to have a much larger sample size and also be able to provide all interventions myself and follow the participants for a longer period of time. I think it would be incredible to do this with everyone that enters the bereavement program, to really truly see how much an effect it has. Again, it is very situational. It's difficult with the post then pre design, the retrospective design, because you have to go back and try and reflect on how you felt when that's such a difficult time. And a lot of times, people don't want to reflect back on that. So I do see why there isn't a lot of research on the bereavement program, just because it is such a difficult topic, and we don't want to have individuals reflecting on how they felt when their loved one died. But I do think it's very important to see how we can improve bereavement programs overall. And sometimes the only way to see is to see if it's actually having an impact on other people. So thank you very much, you guys, for listening, and have a great day.